Hello and welcome to Module 3, the final module in this training series on service navigation. As a review, in the first module, we learned about barriers to healthcare access, which prevent individuals and families from receiving the services and care that they need. In the second module, we talked about the scope of practice of service navigators, which encompasses many approaches and domains, but essentially is to help individuals and families overcome barriers to healthcare access and access to other services. Now, in Module 3, we will go over the results of a survey that was distributed to service navigators in Minnesota. By the end of this module, you should be able to describe service navigators' perceptions of the importance of different domains of their work, identify which domains navigators want or need more training and/or resources to support them in, and explain how navigators view evidence-based practices. This study was a digital survey distributed to workers in service navigation in Minnesota. 91 navigators responded to this survey. We asked navigators about their attitudes toward the domains described in the previous module and whether they wanted more training or resources in those areas. We also assessed their self-efficacy and attitudes toward evidence-based practices. Of the 91 participants who responded to the survey, 76% of them worked directly with clients providing service navigation. 15% of them supervised navigators, and 9% of them were administrators in service navigation. Most of the supervisors or administrators we spoke with in follow-up interviews also had worked directly with clients as a navigator in the past. On average, these workers had been in the field of service navigation for 11 and a half years and had been in their current position for 4.7 years, but there was a wide variety of experiences among the navigators. In the last module, we went over 19 domains of practice of service navigators. Those were drawn from current literature on service navigation, as well as practice documents for navigators and community health workers. Of those domains, the ones that participants rated as most important were establishing and maintaining working relationships with clients, so building trust, rapport, mutual respect, and understanding, and providing empathy, compassion, and support, so reflecting clients' frustrations or challenges and providing emotional support. Those rated as least important were building and maintaining client motivation, so identifying where someone is in the stages of change, working with and resolving client ambivalence or lack of follow-through, as well as advocacy and outreach to providers and community, so contacting service providers and other stakeholders to advocate for service access on behalf of clients. However, overall, the domains were rated highly in terms of their relevance and importance. This shows that these domains do describe the scope of practice of navigators well. This box plot shows the distribution of responses for each of the 19 domains. The participants were asked to rate their perception of the importance of each domain on a 7-point scale, with 7 being the highest. And you can see that for many domains, the median response is 7 out of 7, and the lowest median response we see is 6 out of 7. So since these domains are all seen by navigators as being important and relevant to their work, then it is important to know in which of these domains they would like more training and resources to support their work. Interestingly, the domains in which participants had the lowest need for training were also the domains that participants rated to be the most important, establishing and maintaining working relationships and conveying empathy and compassion. This means that navigators are already well prepared to do the most vital aspects of their work. However, navigators may need support in other areas of work that are also important. They rated their need for training and resources highest in the domains of cross-cultural practice, so working effectively with clients whose culture is different from their own, and problem solving challenges. So, working with a client to resolve a persistent service barrier, such as wait lists or transportation issues, and anti oppressive practice. So, recognizing the effects of oppression, identifying structural issues that impact clients' access to care, equalizing power imbalances in working relationships. This shows that navigators specifically have a strong need to be able to work with members of often marginalized communities in a way that supports and empowers them. It also may indicate that the challenges participants face are often of a structural nature or relate to specific barriers that clients face, such as housing and transportation. This is in line with what navigators told us in interviews that many of the barriers that they face in their own work are structural ones, such as long wait lists for services, need for services being greater than the resources available, policy issues, and economic challenges like lack of transportation or housing. Overall, navigators rated their need for training and resources in each domain as moderate to high, but there was more variation in these ratings than there were in the ratings of importance. As you can see, the median ranges from 4 to 6 out of 7, where 7 indicates the highest need for training and resources. So let's pause here for some discussion and or journaling. First, think about what areas of your work you would like more training or support in. Is there any overlap with the training and support that navigators need? Do you think that you and or your organization could help navigators that you may work with meet their needs for training and support in the domains we discussed? If so, how? Moving on, in our survey, we also assessed participants' attitudes toward evidence based practices in this survey using the evidence based practice attitude scale. For anyone who may not already be aware, evidence based practice is a term that describes approaches to work like navigation, as well as social work, clinical work, and so on, which are supported by high quality research findings. This scale was developed by Ahrens and colleagues in 2010, and it was a measure of practitioners' perceptions of and their feelings toward evidence based practices. We used a briefer 36 item version of the original 50 item measure, though the 36 item measure has also been previously tested and validated. There are 12 subscales within this instrument. The subscales each measure aspects of practitioners' support or disagreement with evidence based practices. The subscales measured first whether participants would use evidence based practices if it was required by their supervisors or administrators, the appeal of using evidence based practices, participants' openness to using evidence based practices, their divergence from wanting to use evidence based practices, the fit of evidence based practices to their own practice and clients, their attitudes toward having their own work be monitored, beliefs about a balance between evidence based practices and non evidence based practice, the perceived burden of evidence based practices, perceptions of how evidence based practices help with job security, organizational support for evidence based practices, and attitudes toward receiving feedback. As you can see, some of these subscales measure positive attitudes toward evidence based practices, whereas others measure disagreement or negative attitudes toward evidence based practices. Overall, navigators scored highly on this measure, indicating that their attitude towards evidence based practices were very positive on average. The subscale in which navigators had the highest scores were the fit of evidence based practices, meaning that the navigators most strongly agreed with the use of evidence based practices in situations where it would be the right fit for their clients and approach. The negative subscale that navigators agreed with most was balance of evidence based practices with non evidence based practices, meaning that they would see their work as both an art or a science, or as drawing on practices that are not evidence based as well as those that are. Participants' attitudes toward evidence based practices were related to some other important things in the survey as well. Navigators who were more open to evidence based practices also reported more need for training and resources, as did navigators who perceived evidence based practices as having high value for their job security. In addition, navigators who saw evidence based practices as limited in their application also had more need for training and resources. To close out our discussion on evidence based practices, here are a couple more discussion questions. First, what have your own experiences with evidence based practices have been like? Do you use them in your own work? And how could evidence based practices be applied in your work if they're not already? Next, let's discuss self efficacy, which we also measured on our survey. Self efficacy means belief in one's ability to achieve something. And this scale that we used was the General Self Efficacy Scale, which was originally developed by two researchers, Schwarzer and Jerusalem, in 1995. Self efficacy was an important variable to consider because it was shown in the past to affect the efficacy of training and the application of training to real life practice. Overall, Navigator's self efficacy was moderate. 22 was the average score on a scale from 10 to 40. In addition, the distribution of these scores was bimodal, meaning that there appeared to be two groups of navigators, one with generally lower self efficacy and one with generally higher self efficacy. And it was about half and half in each of these groups. This may be important for supervisors and others who work with navigators to know, so they can foster self efficacy among navigators. Among our sample, higher levels of self efficacy corresponded to higher perceived importance of the domains of practice in navigation. Self efficacy did not correspond with higher levels of needs for training or resources in these domains, though. But as mentioned earlier in previous literature, higher self efficacy has been associated with better understanding of and implementation of training. This indicates that in addition to improving self efficacy among navigators, it is also important to make sure that any training and resources offered to navigators are important and valuable to them. So, a few final discussion questions. First, why would it be important for navigators to have high self efficacy? Second, how can we make sure that training and new practices that we offer to navigators are valuable and useful to them? And finally, how might the understanding of self efficacy and training needs that we just discussed be helpful for those who work with or supervise navigators? Here are the references for this module. Congratulations on completing the final module in this series, and thank you for your time and attention.